Finding time for research when you have a busy clinical load is hard. I feel like sometimes I have the divided mind, but actually sometimes that makes my clinical load better, so it's nice. Finding the time, I think you need some structural things, and you need some things within yourself, and you need some things within the department, some personnel things that you need to kind of sort. So if I think about the structural things, I think about getting money, if you can, to release yourself. It creates time. And so as much as I could do that, I've tried to do that. For me, I also went part-time in my work because I knew that I would find it difficult to go any other way. I don't think that's the way for everybody, and I don't think everybody needs to do that. But I knew for me, that was one of the ways I was going to be able to do it. Doing research on what you're working in makes a big sense. So then you can use the data sets that are available at work.
I got started in research whilst working in a previous clinical role. I was very lucky in that I was working on a QI project, and at the time we were linked with an existing researcher from the University of Sydney who provided me with support in terms of progressing that QI project from being just a QI project into a small research project. And through that mentoring and support, I found that I had a real interest in research and then was very keen to look at expanding my skills in that area. I think the important thing again is to look at picking a question that you can incorporate into your clinical work. That also helps with keeping you motivated and on track because it's relevant to what you're already doing. Setting some really clear goals around things that you want to achieve and having really clear timeframes always helps with that, but always being kind to yourself and giving a little bit of flexibility around those. I've also been very lucky in that I've received a research grant to support one of the studies that I'm currently doing, and that's been a big help because that's provided me with funding to arrange backfill to my clinical position, which has given me more time to dedicate to the research project, as well as the opportunity to hire research assistants to support me in completing that project in a timely manner.
I think the way that I found time to do research with my clinical load has really been to do something that's been designed around my clinical load and something that's important for my clinical load. I think most clinicians are going to always put their patients first and want to put their patients first. So if you can find a research project that does exactly that, that is designed for their benefits or for their needs, then you can feel less guilty about taking time away from a clinical environment. I also had a very good opportunity to design a project around patients I was seeing. So that meant that essentially my recruitment was my patients that I was treating. Some of the interventions we delivered in one of our research projects was treatments that I was going to be delivering anyway as part of my normal clinical work, and that really made it feasible and able to juggle both. The other thing that made it possible to balance the two was really having some really good support around you. So if you've got a team of managers or supervisors who understand why you want to do it and the benefits of doing it, and they get a buy-in with that, then they're really going to be supportive and encouraging to allow you to take time, study leave if needed, or take some time out to actually do some of the processes that are required for it. And having other team members who are interested in what you're doing to do some of the work for you, so recruit some patients for you, do some follow-ups for you. If you get a buy-in for that, then that definitely makes it feasible and makes it possible.
We have to be prepared that personnel are going to come in and out, and have contingencies, planned contingencies around those things. They might not be babies, but we have to become carers, we have to step out of work for a while. Things are always going to happen. So we try and plan contingencies and have teams involved where we can, selective teams, so they're people who really are interested in research and in making it happen, so that we can keep these things moving on.